welcoming remarks for the last few years, and I know that we'll really miss her. But we're absolutely thrilled to have Kathy here, a good friend of hers, who is the publisher of the Washington Guardian, another great Washington publication. So let me, without further ado, introduce her and thank her very much for coming. We're here today to honor extraordinary women who inspire us with their accomplishments, strength, sense of purpose, courage in breaking down barriers, and ability to do all of the above without losing their cool or their sense of humor. Like many of you who come here to recognize these foremothers, I am the fortunate product of strong, smart, resourceful women. My grandmother came to this country from Lithuania all by herself. She was 16, she had no education, she didn't speak a word of English, and she only knew one person in America, her brother. When she came through Ellis Island, within days of coming through, her brother passed away in a flu epidemic, but she persevered. My mother was the first in her family to go to college. They grew up in Scranton. My grandmother landed there, and she had my mom, who today is a Grandparents' Day, my kids' school. She had a successful career in theatrical public relations and went on to be a publisher and a supporter of education and cultural institutions. She taught my brother, my sister, and me that the most talented among us are also the ones who work the hardest, stay the latest, and don't forget where they came from. A story. My mother worked in New York out of college with the great Ethel Merman when Merman was starring in Gypsy. She was already a big star on Broadway. She was the first one there, last one to leave. But my mom noticed that when she wasn't rehearsing, that Ethel Merman would sit and take steno and write down everything everyone said who was on the stage rehearsing. And my mom asked her one day, why do you do this? And she told my mom, I started out as a secretary, and I never forget that if this thing doesn't work out, skills to go down. So having a backup plan. It's that kind of pragmatic wisdom matched with unparalleled accomplishment that we recognize today with the 2011 Foremothers. It is a privilege to be here with these remarkable women. I congratulate Eleanor Holmes Norton, Vicki Sant, Judith Worst, and Peggy Hamburg. Please put your hands together. Thank you. Treatments to be as effective as they can be and to be as safe as they can be. So a lot of what our center does is try to translate the latest research information into usable information so that all of you in this room and all the people you care about and everybody else in the
Washington, D.C. and the country has access to the best possible, latest, greatest information about, what are the risks and what are the benefits of different medical products, different medical procedures, and also in social issues, because so much of our lives, how we live also affects our health. So the book that we've handed out, The Survival Guide for Working Moms and Other Stressed Out Adults, is a book that we wrote. I co-authored with Randall France de Bravo from our staff. And it takes all the research information and makes it very simple, easy reading that even a working mom might have time to read. And that's a good example of how we take what is sometimes very complicated information and make it easy to use. So on FDA issues, there's a lot of pressures to approve new products and get them to the market as soon as possible. We all want the best medications available as quickly as possible. We want the best medical devices as quickly as possible. We want the best food as inexpensive and fresh and healthy and great as possible. But we have the Food and Drug Administration, the FDA, to help make sure that the food we eat and the medications we take, and by the way, the medications our pets take and the food that our pets eat, are actually safe and in terms of medications that they actually work. So that's a big part of what we do, and we spend a fair amount of time criticizing the FDA, and I've often said that we're very strong critics, but also the greatest fans of the FDA, because I really think there's no more important agency in this country in terms of keeping us all safe. They're responsible for 25 cents of every dollar spent in this country. So we were just very thrilled to have the opportunity to thank Dr. Margaret Hamburg, Peggy Hamburg, for the wonderful work she's been doing. She's only been heading up FDA for a couple of years now, but she's already moving the agency towards that public health perspective that had, I'm sorry to say, been missing for a while, and balancing all those pressures, which are so hard to do, the pressures to get things to market because the companies want them to market and the patients want them, but also to make sure that they're safe and effective and hold all companies to the same high standards so that we can feel safer and better about what we're doing. So it's really my thrill and pleasure to give her this award today.
But I have always known that Diana and the organization that she heads and founded is one of the most important fixtures in terms of the importance of having thoughtful and dedicated individuals and organizations that watch the work of FDA, that hold us accountable, that advocate for the critical issues that FDA must stand for, and that understand that it is vital for the health, safety, and well-being of our nation, and frankly, for the world, to have a strong, smart regulatory agency, to have a science-based, data-driven regulatory agency with a mission that is grounded in public health, which is to promote and protect the health of all. So it is very, very meaningful to get this Health Policy Hero Award and to be honored here today with so many other women who are inspiring in their own areas of work and practice and contribution. I'd also like to mention that I'm here today with my mother, Dr. Betty Hamburg. And she has been one of the biggest inspirations in my life, a role model, a mentor, a source of support and comfort and love at every stage And she is certainly someone who has really been a living testament to what women can achieve when they have passion and a real sense of purpose. She has broken many barriers. She was the first African-American woman to be admitted to Vassar College, the first African-American woman to be admitted to Yale Medical School. So anyway, it's a great pleasure to have her here with me today, and my only criticism is that she often made it all look too easy. But, you know, I really have been so fortunate, certainly in the parents that I've had, but in the career opportunities that I've been able to pursue, and to be able to have found a profession that has given me so much satisfaction, and where I've been able to apply that same sense of passion and purpose that my mother raised me to so admire. And at the FDA, as was mentioned, you know, we really do things that matter. It is a unique and essential agency with a huge, vast set of responsibilities that span, as Diana was saying, the responsibility for safety and effectiveness of drugs, devices, vaccines, biologics, cosmetics, dietary supplements, things that emit radiation, the safety of the food supply, the safety of the blood supply, and now also the regulation of tobacco products. This is a hard time for agencies like this. Not only is the job hard because no matter what you do, somebody is unhappy and they usually let you know, but it's also a hard time because many people are questioning the role of government, and many people are assuming that all government agencies are fat, that the employees are lazy, and that one can cut deeply into the activities of those agencies and not make a difference in the lives of the people of this country. And the FDA is an agency where I can say the people are there because they're dedicated professionals. They could be making much more money in many other sectors, but they chose to work at the FDA. The work we do makes a difference, from the food you eat at breakfast, to the sunscreen you put on when you go out the door, to the drugs you may take to control a condition, or the vaccine to prevent a serious life-threatening disease. And it really is inspiring to lead an agency like this and to have the opportunity to be an advocate for what this agency is all about, what it needs, and why it matters. So to get an award like this, I certainly don't view myself as a health policy hero or a hero of any kind. I'm just trying to do my job and make a difference. But it is a great honor, and one of the traditions in our family, actually begun by my mother, is any important occasion we like to quote Eleanor Roosevelt. When my mother was in college, actually, she had the opportunity to get to know Eleanor Roosevelt just a little bit, because Eleanor Roosevelt was interested in education, and particularly the education of women. So in Eleanor Roosevelt's honor, and on the occasion of being named a hero, though I don't feel myself to be one, I want to quote her. "We do not have to become heroes overnight. Just a step at a time, meeting each thing that comes up, seeing it is not as dreadful as it appears, discovering that we have the strength to stare it down." And I think that each of us, in different ways, are heroes, trying to do things that really matter in our own lives, for our families, and for our nation more broadly. So thank you very much.